Whether you are in USA, UK, New Zealand, Australia, or somewhere in India, welcome to a practical and useful guide on understanding gynecological ultrasound reports. Whether you call it an ultrasound scan, USG, or sonography, this article will demystify the complex medical jargon and help you make sense of your ultrasound results. From the basics of what an ultrasound is, to interpreting the detailed finding about your kidneys, bladder, uterus, and ovaries, you have got you covered. Dive in to learn how to read your ultrasound report like a pro and make informed health decisions. First, let's get you acquainted with two most important terms. Radiologist, a specialist doctor who performs ultrasounds. They also report on CT scans and MRIs. Sonographer, the person who conducts the ultrasound scan. They might be a doctor or a nurse. In the Western world, most scans are done by carrier sonographers, professionals who are not doctors or nurses but perform scans with remarkable expertise. When a specialist radiologist performs a scan, they are also considered a sonographer. Gynecological ultrasounds come in two varieties: the transvaginal ultrasound scan and the one done over the abdomen. If a transvaginal ultrasound can be done, that is usually the gynecologist's go-to choice. Here is why. In the world of gynecology, all the top-notch research, measurements, and decisions are based on data from transvaginal ultrasound scans. It is like choosing the best seat in the house for a clearer view. So, if you go for an abdominal ultrasound, it might not align with the latest research advancements. Why, you ask? Because the uterus and ovaries viewed through an abdomen ultrasound can appear different in size and detail compared to a transvaginal ultrasound scan. There are some differences between the reports from these two types of ultrasounds. Here is a handy guide to help you read and understand both types of reports with ease. Some basics. When you first get your ultrasound scan report, make sure to check some basics. For instance, ensure the patient's name is correct, the age is mentioned, the time the ultrasound was conducted, the reporting time and doctor's name are all accurately stated. These are standard procedures for patient identification. Having two patients with the same name is not unusual. So, it is essential to verify these basics first. Know which part was scanned. Next, find out which part of the body was scanned by the ultrasound. Is it a full abdomen scan, lower abdomen, or a specific part of the lower abdomen known as the pelvis? I might ask someone, do you have stones in your gallbladder? And they might reply, I had an ultrasound but no liver issues are found. If I remain suspicious, I double check and often discover their ultrasound was of lower abdomen, where the liver or gallbladder were not visible at all. So, an ultrasound does not necessarily mean every part of the abdomen has been imaged. Think of it in this way. If you take a photo in Agra, you will get a picture of Taj Mahal, but you won't get a snapshot of Kanyakumari. Naturally, an organ issues in Kanyakumari will remain unknown from an Agra scan. Hence, it is crucial to know which area of the abdomen was scanned. Kidneys. Many radiologists nowadays include a bit about the kidneys when doing a gynecological ultrasound of lower abdomen, so your report will likely start with the kidneys. However, keep in mind that transvaginal scans don't show the kidneys. The report usually mentions the size and shape of the kidneys and whether they have got any stones, tumors, or cysts. It is important to note that up to 70 out of 100 kidney stones might stay undetected by ultrasound. Kidney cysts. If there are any cysts in the kidneys, they need to be examined carefully, whether they are simple or complex, and their size. These cysts are different to the ovarian cysts. The Bosniak score can help in diagnosing kidney cysts, as it indicates the condition, benign or malignant, of the cysts. However, remember that the Bosniak score is primarily designed for CT scans. So, the score obtained from an ultrasound might not always be reliable. CT and ultrasound technologies are different. Ureters. The ureters are the two thin tubes that carry urine from the kidneys to the urinary bladder. These thin tubes are usually not visible on ultrasound if they are normal. They only become visible when they are dilated. If dilatation is seen, further examination is done to find out why urine is not properly reaching the bladder and causing the ureters to swell. Thus, the report will only mention if the ureters are dilated. It won't directly state that normal ureters were seen in the scan. Then come to the comments on urinary bladder. When you first glance at your ultrasound report, you will find details about the size, position, shape, and outline of urinary bladder. Sometimes you will also see something called residual urine. Residual urine is the amount left in the bladder after you have relieved yourself. Typically, we get the urge to go when about 150 to 200 ml of urine has accumulated. We can hold a bit longer and we usually pass around 300 ml, roughly the amount in Coca-Cola can. However, a bit of urine, 10 to 100 ml, remains in the blood. If over 100 ml stays back regularly, it could lead to infections. Just like still water in a pond collects algae, stagnant urine can foster bacteria growth. Holding urine for too long weakens the bladder muscles and cause it to overextend. Consequently, the bladder can't empty completely, increasing the risk of infections further. Additionally, as we age, the urethra, the passage for urine from the bladder, can narrow, causing urine to accumulate further inside the bladder. For men, however, an enlarged prostate is the major reason for urine retention. Gynaecological organs. When performing an abdominal ultrasound to view the uterus and ovaries, an obstacle known as gas in the abdomen can interfere with image clarity. Everyone, from the world-renowned intellectuals to American presidents, beauty queens, and regular folks like you and me, has abdominal gas. Since ultrasound uses sound waves, this gas hampers the passage of the waves into the abdomen. Thus, the image of gynecological organs can appear blurry. The solution is to create a window through which the ultrasound waves can pass easily. Sound waves travel well through metal and liquids. Since there is no metal in the abdomen, we use liquid windows instead. By filling the urinary bladder with urine, a liquid window is created in the lower abdomen. Through this urine, the ultrasound machine can send its sound wave directly to the uterus and ovaries, resulting in clear images of the gynecological organs. During a transabdominal ultrasound, it is essential to have a full bladder. For transvaginal ultrasound, since there is no colon or gas obstructing between the ultrasound probe and the uterus, the bladder does not need to be full. Hence, a transvaginal ultrasound requires an empty bladder. Let's have a little chat about the uterus. Quite a remarkable little organ, really. There are 3 key things you need to know about it. Before that, though, some general bits and bobs. An ultrasonographer will jot down the uterus's size, shape, and condition. They might also note if the uterus is bulkier than usual. But don't worry, unless it is significantly enlarged, a bulky uterus does not usually carry much clinical significance. You see, just like our fingers, no 2 uteruses are exactly the same. But many people get quite alarmed when they see bulky uterus on their report. Think of the uterus as a fancy hotel room for the baby. This room is formally called the cavity. We need to check if this cavity is empty. If not, there could be polyps, blood, or fluid inside, all of which should be noted in the report. Next, endometrial thickness. One crucial piece of information is endometrial thickness, which refers to the inner lining of the uterus. It's thinnest right after your period and thickest just before the period starts. There is some debate about what thickness is ideal, but science gives us a few clear measurements only. After menopause, the endometrium thickness should be 4 mm or less. For those still having periods, determining what is normal and what is abnormal is still a bit of gray area. Women with PCOS can't always have their endometrium checked easily, yet many experience irregular bleeding. For those women, it is best if at least sometimes in their cycle the endometrium thickness drops to 7 mm or less. That's all is known about endometrial thickness. In my personal experience, if there is no other issues, but in young women, if the thickness goes beyond 17 mm or beyond 4 mm after menopause, or if the thickness is uneven, there might be polyps or hyperplasia inside. So I investigate further. Myometrium. Besides the inner lining, the uterus has an outer muscular layer called myometrium. This is where fibroids form. To confirm a tumor as a fibroid, it needs to be examined under a microscope. Before a biopsy, it is better called an SOL or space-occupying lesion, rather than jumping straight into a diagnosis called fibroid, because some tumors might not be fibroid. Fibroids can be in three main places: outside the uterus, inside the muscle wall, or towards the inner lining or the endometrium, or towards the cavity. Those are near the endometrium can cause abnormal bleeding. Ultrasounds are done commonly to monitor size changes. However, measurements by ultrasound are not as accurate as MRIs. Differences in probe position and machine focus can cause size variance. No need to worry about slight differences in measurements. If the difference is significant or symptoms worsen, treatment might need to change. That's why both your doctor and you need an analytical eye. Next up, ovaries. Let's move on to the ovaries. Those tiny, almond-shaped, often elusive organs. Sometimes they hide behind a bit of gas in your abdomen, making them hard to spot on a scan. Especially after menopause, the ovaries shrink even more. So it is not uncommon for your ultrasound report to say things like ovaries obscured or ovaries not seen. But don't worry, this does not mean the ultrasonographer is clueless or that your report is wrong. It is just a normal variation. Now, if there is a cyst in the ovary, it becomes easier to spot. The size of the cyst measured in centimeter will be noted on the report. Polycystic ovaries might also be checked for, where small cysts accumulate under the ovarian surfaces. Despite sounding similar, cysts and polycystic ovaries are quite different entities. We have a separate video on that, link will be below. If a cyst is found, the most important thing is to note its ORAD score. This helps determine if the cyst is simple or complex, which affects your treatment plan, whether it's medication or surgery, and for how long. We have a completely different video and article on that. I will link it down below. Pouch of Douglas. Next, you will see a comment about pouch of Douglas of POD. A small amount of fluid here is normal, but if there is a lot, it is wise to seek a doctor's advice. Fallopian tubes. Ultrasounds typically don't mention fallopian tubes because normal ones are not visible. If the tubes are abnormal with fluid or pus, they become visible and their name and size will be noted. Practical tips. Before wrapping up, a few practical tips. It is tempting to look for the cheapest ultrasound scan around, but don't risk your health or future generations' health for a bargain. The high-quality ultrasound scans take time. Whether it is a sonographer or radiologist, they need enough time to do a thorough job. That is why good scans can cost a little more. The more experienced and dedicated your ultrasound doctor is, the more accurate your report will be. And remember, always take previous scan reports with you for comparison. Going for an ultrasound with a "let's see if they can spot it" attitude isn't advisable. I have shared quite a bit here, but remember, the ultrasound is a complex science. So don't try to interpret your report based on YouTube or Facebook. Sit down with the doctor who prescribed the scan and get all your questions answered. That's all today. We'll see you soon over another video research article.